Welcome back to Untethering Shame, the podcast where we tackle shame head on and explore the tools and stories that can lead us to healing. I'm your host, Kyira Wackett, and today I am beyond thrilled to welcome back Paige Bond. Paige is a licensed marriage and family therapist who specializes in supporting individuals, couples, and ethically non-monogamous relationships with intimacy challenges and relationship anxiety. She's also the host of the Stubborn Love podcast, where she shares actionable advice to help people build healthier and more fulfilling relationships. If you haven't already, be sure to check out her earlier episode with us, where we explored shame and non-monogamy. It's such a powerful conversation that you don't want to miss. Now, today, Paige is joining us to discuss an entirely different topic: shame and psychedelic-assisted psychotherapy, or PAP. This emerging therapeutic approach is gaining traction as a tool to support healing for clients dealing with various diagnoses, including treatment-resistant depression, PTSD, and other mental health challenges. But along with its potential, PAP can also carry layers of shame. For some, it's the feeling of failure after struggling with quote-unquote traditional therapies, while for others, it's the stigma of engaging in a modality that challenges conventional mental health practices. In this episode, we'll unpack these layers of shame, explore how PAP can open doors to healing, and discuss why this topic is so important to break down barriers for those seeking a path to wellness. Whether you're curious about this therapeutic approach or just want to better understand the intersection of shame and innovative mental health practices, this conversation will open your eyes to new possibilities. So join me and let's dive in. Paige, I don't even know what the word is. Excited, ecstatic, overwhelmed with joy that you are back and that I get to see your face as we were getting ready to record, realizing it has been a year and a half. And yet I feel like I talk to you all the time, even though I don't. Like there's this, I felt like I had an emotional hug from you the moment I came on. I just have all the swirling feelings, but ultimately, if I'm boiling it down, I'm just so happy you're back.
I can't get rid of the smile on my face, and I feel like I think it's stuck and it's gonna hurt after a while, but I feel the same way. So it's so good to be here.
And I think it's fun because I kicked off the podcast with our episode.
I know.
That was so exciting to me. And I was like, ooh, this feels a little risky. My first episode is going to be on ethical non-monogamy and having this conversation. And gosh, I know a lot of the people that follow me, they might be a little bit what the fuck? And it was amazing. And it was so well received. And so many people were able to hear about a topic that their own shame, cultural norms, biases maybe stopped them from thinking about and exploring. And so it was, I think, just a beautifully crafted invitation for people. And that was really the gift, I think, in how you share things. And so I'm excited that as we're talking about this topic today, because this is another psychedelic-assisted psychotherapy, which is a mouthful, is, I think, another topic that's getting a lot of resistance. It's like an all or nothing with how people are approaching it. And there's a lot of confusion, a lot of misinformation, a lot of walls up. I don't want to go there. It's basically just condoling drug use in all over the place. So I'm excited for the invitation that I know you're bringing to listeners again today.
I'm so glad I had that impact last time, and I really hope I get another win under my belt.
Well, okay, so then let's start with, what does this mouthful of psychedelic-assisted psychotherapy, what does that mean? And how did you decide, yep, I'm going to go here? This feels like the next step in my journey professionally.
Yeah. So psychedelic-assisted psychotherapy is, the actual use of psychedelics, but under the supervision and care of a medical team and a therapeutic team that is working tirelessly to help you get the outcome you're needing for treatment when maybe regular talk therapy has hit a wall for you, or there are some parts in therapy that are hard to face. And psychedelic assisted psychotherapy can help soften those rough edges for people to go to a deeper depth than they regularly just were not able to with good old talk therapy, sit on my couch, you know?
Mm-hmm.
What got me interested in this? I mean, I've been interested in this realm for years. I mean, I grew up in a household with addiction. So I've been like very anti-drug for a long time.
Yeah.
And like I saw myself as this like cool, straight edge person who didn't do drugs because it affects you so badly. And as I got older, I'm like, oh, drugs could actually be used in a really great way to help people take them to a different space and actually improve their mental health rather than just stay stuck and have poor coping skills and drag themselves into the ground, like when used appropriately. So there's a
Mm-hmm.
huge difference between doing drugs for fun and doing drugs with intention. I'm going to use that word a lot in this podcast, intention.
Okay, that like kicks up so much for me. Just thinking about the idea of what is the intention behind anything that we do. Anything like having worked in eating disorders for a long time, what is the intention as you are grabbing that big giant bag of M&Ms, and like a lot of that awareness bringing to individuals around what are we either trying to avoid, suppress, cope with, or how are we trying to move forward, and what does this tool, whether it's a maladaptive or an adaptive tool, what is this tool doing for us? And so you said something that's really interesting. So there's both a medical and a therapeutic team involved. So are they getting a prescription, and is it something that like therapists refer to their medical provider, or medical providers are like, hey, I think we should do this, and then let's find you a therapist? Or can it go either way?
It can go either way, and there's a lot depending on this because this is also really state dependent.
Right.
And I personally work in the realm of psychedelics using ketamine assisted psychotherapy, though out west where you're around, we are doing trials, and some places are able to provide MDMA assisted psychotherapy or even psilocybin.
Mm-hmm.
If you want to go international, though, I'm sure you can find
Lots of other
others if you
things.
are interested.
Yes. Yes.
So, the way the referral process can go either way, I will say that not all medical providers are going to be trained in this type of medicine, and not all providers are also going to be on board with it and may scoff at it. Or there also might be some misinformation or stigma that some medical providers might have for this. So, sometimes the process can be there is a doctor or a nurse who is trained in psychedelics and are really familiar with the process of what the certain drug will do to the body and how to work with a therapist and making sure, we're on track. But a lot of times it's either clients that I am already working with, or I can get a referral from other therapists who may be getting stuck in talk therapy, and they'll refer to me as an adjunct to work specifically within this dynamic of psychedelics with them.
Oh.
Or people may just find me because I work in psychedelics and that's what they're looking for. And then I connect them to the medical team and determine eligibility.
Yeah, it's interesting. I feel like I'm trying to have this conversation from the scope of my bias tends to be, I would say, I'm like, if it's a 0 to 10 scale, I'm probably at like a 7 of support, because I have, similar to you, addiction history in my family. I know and have watched drug seeking behaviors in the context of therapy environments and medical environments. And so I think I have some of my resistance walls that are still up. And then there's also this like, I just don't know enough about it to say I'm a 10. Like, I don't think I could confidently do that with the information I have right now. I know some people listening are going to be like, yeah, I'm at a 1. Like, I am. How do you know? Even when you're saying the word intention, people lie all the time about their intention. And are we just basically like setting people up to just find legally supported ways to get high. And so I think there's also a misconception around how much of a drug someone is using. And again, there's different levels and experiences based on that. So I know you specifically are working in ketamine. Jordan uses it in the emergency department. People are higher than a fucking kite because he's doing these, really painful things for people. They're coming in and their body is broken, particularly with kids. Ketamine works really, really well with kids in emergency situations and with breaks and bleeds and things like that. So my experience is that's a way different dose than what you're doing. So just thinking through the layer of like the people that are a 1 and a 2 right now that are like, I just think people are just trying to get high in a legal way. Could you help dispel that a little bit and talk a little bit about dosage? And again, like intention and the experience. Like this isn't meant to be fun. It's meant to be therapeutic and ideally freeing long term.
Yeah. I will say that it would be pretty hard to just get high or addicted when using this in a therapeutic setting because we make it really difficult for that to happen. One, it's not like we give you an unlimited supply. Like we're not a drug dealer here for clients. And there is a limit. The medical team determines based on height and weight, what is your bioavailability going to be for the certain medicine and how much would be conducive for an altered experience, but not going to put you out and ready for surgery or something like that, or going to make you climb on the balcony and do something wild, right? So we really structure this in a way where it makes it difficult to even try to become addicted or to just do it to get high. So I will say like there's a lot more to it than just like the dosage is a lot lower than like in medical settings like that. But outside of just the amount that you would be getting, we do this in such a therapeutic way that yes, you may have like a really like big internal experience, but you're still there the whole time. Yes, you're going to feel like probably effects of like dissociation and your body's going to feel different, or maybe parts will be numb and you might have visuals that come to mind or whatever happens, right? Everybody's journey is different. But you're still going to be in that therapeutic space. So there's like a certain point of, and it's a very temporary time too. This doesn't last like hours on end. Usually a journey is anywhere between 45 to 75 minutes. And then you're coming down, you're landing the plane. So this isn't like you're just going to be gone for hours on end. So there's so many aspects that make it really difficult to like abuse this in a way, because there's also not only the dosage limit, the setting that it's used in, but also how often we dose sessions. And in addition to that, there's like usually it depends on the medical provider you're working with. So what will happen is usually you get about 2 doses at a time, or you could get up to 4. So again, you're not going to have this unlimited supply where it's just a free for all. You get to do ketamine anytime you want. And if we see that you are not following the protocol with your therapist, you're going to be access revoked. We're not going to keep you on, and we're just going to be blacklisted.
Well, I think it's interesting when you sort of describe it. Again, this is where I'm going to kind of wear both sides of the hat. Is I think about the number of times that I felt it myself in therapy, although I think I've experienced it more directly with clients where you can watch. My husband and I were just talking about this. This happens to Jordan too. Like much less now, having been together for 14 years with somebody who's like, no, we're going to talk about everything until it's not hard anymore. But like you watch the walls go up, you watch the defenses come into play, you watch the self-preservation and protective instincts come into the room. So we as the therapist can be like, if we could just break that wall down, we could go there and there potentially could be relief, but they aren't able to do it. It's like a muscle. Like I think about having to take muscle relaxers when my jaw, I had such bad TMJ, all the PT in the world wasn't working. I had these like weird massages where they would go in your mouth massages, which is like so weird and gross and uncomfortable, and you're just in pain, and that nothing would relieve the muscles. They were so tight. The only thing that I could do was I had to be dosed up on such a high dose of muscle relaxers for like 48 hours. It wasn't even that long, but as soon as they could get enough in there, the muscle could come down. And now, like, I'll be able to feel when it'll get tight and things like that. But like now, these other tools and skills will work. But at the time, they didn't. So I'm kind of comparing that in my brain of like, the goal also is once those walls start to come down and therapeutically, you're not only processing, but helping then on the back end of reestablish safety and security in the individual person, in the space, move through the healing. My guess is you're seeing a natural progression where the freedom, the movement that happens for the client, they're also naturally getting to a place where they're like, I don't need this anymore because I have a sense of peace I didn't have before. So there's also kind of a fourth support against the addiction, which is really like the relief that they're getting. Like, I don't want to be high on muscle relaxers all the time. That was terrible. I couldn't even like sit up. I couldn't even watch a movie. But fuck, was I grateful I had that. And now when I start to get a spasm, I'm like, you can put your fingers in my mouth and do your weird PT massages. I'm willing to do that because I know we can manage it at that level.
There is a metaphor I came up with after my first CAP session. And what I love dinosaurs, so of course it's like a Jurassic Park analogy. Like this is such a Paige thing. And so I described the differences between talk therapy and ketamine like this.
Mm.
So you're at the dig site and you're wanting to like go look at the fossils and like see what's there.
Mm-hmm.
And how I see talk therapy is you're over at the car and you're just getting out of the car. And like you can probably see the fossils like yards and yards away, but you're not getting there. And the fossil in this scenario is basically all of like the juicy depth that we haven't gotten to maybe in talk therapy, or like the really vulnerable place where a client may be too scared to go.
Mm-hmm.
And how I see ketamine is, or any psychedelic really used in that therapeutic way, is I see ketamine as the gentle toothbrush that they use against the fossils to like brush off the dirt and kind of cleanse the fossil to like be able to get it lifted out of the ground or just like have a visual on it.
Mm-hmm.
And it like actually is such a gentle medicine itself, but that's how I compare the two of talk therapy versus psychedelics.
I think that's such an approachable way to consider it because, again, it's just the level of accessibility. I did brain spotting with somebody that it was, I'm like maybe a 6 or a 5 on that. I'm like, that just feels weird. Like you're just asking me to move my eyes in different spots. And, it feels very similar to EMDR. I will promote this. It's the same as I know like yoga and stretching is really good. It's sometimes hard for me to buy into making that a part of my life. And so when I did it, I could feel some of that resistance, but I took it in with me. And it's interesting. Sometimes I also think it's sort of an unconscious or subconscious willingness to do something different that allows, like in this case, we're really talking about a drug that can take the wall down, but it's also just this notion of like, when we're going at something the same way and we don't step back, we don't try a different way, we're also coming into talk therapy because most people that are doing this right now have been labeled, and we'll talk about this more in a second, as like treatment resistant. We're not seeing this necessarily as like a universal approach at this point in time. So it's, you also think about someone that's been in therapy so long that they've already got an experience walking into the door for their next therapy session because they're like, well, what the fuck difference is it going to be? What's going to change? Like, I just want to not want to kill myself, or I want to not like that. It's surviving and trying not to go to that high acuity state versus believing even that there's a possibility of thriving. And so I think about, as you're describing this, it's bringing some of those things to the table and maybe allowing somebody to have hope again too, because that reframe mentally is going to have such a different effect in what any type of treatment can do for somebody that we're doing as well.
100%. And I think that's what's so beautiful about this medicine is it can really be just such a different approach that probably hasn't been tried before
Mhm.
in their, treatments. And I think touching on something about the mindset going in is something that can lead you to various outcomes that can happen in a medicine session. Because if we are in this place where we're holding on so tightly and we're not leaving any room for hope, well, yeah, when you come out of that medicine space, you might not have that much of a change. And
Mhm.
I think that's something that like what's cool for me is to point that out and I can say like, hey, this is your pattern. Like, so this is just being brought up to the surface.
Mm.
Now, what do we want to do with that? And then
Mhm.
hopefully take that into a next medicine session if they're still on board with it and see what maybe need to be loosened up for them to have a better experience.
That's so interesting. Okay, so I feel like as we've been talking about this so far, we're thinking a lot about resistance and sort of myths and bias against using this form of treatment. And there's obviously some ways that shame can come up in that. But let's also think now from the perspective of the client. I feel like there's a couple different layers of shame to be talked about. And the first being what we just mentioned, that notion of being treatment resistant. And this, fuck, that was always so hard. Like it would come up a lot when I was doing intensive outpatient and then partial hospitalization program. And they would talk about particularly these adolescent kids as being treatment resistant, and they would get, kicked out from one treatment center to another. These are kids that have been like in some sort of treatment program since they were maybe 9, 10, 11, and just the stories around that. And so first, I just want to give us some space and I want to hear your perspective on just that notion of that term and that experience and how we are subconsciously and consciously and overtly, covertly shaming people in the therapeutic and medical environment by even still using those terms when basically the idea of like treatment resistance is we know all the answers and we've given them to you and you're just fucked up and broken and can't get better. When in reality, it seems like there's a lot of things we haven't tried and don't know. So I'll just pause because people can't hear your reactions that I get to witness you having right now. So I wish I could have just described your faces, but I can see you having that same activation. So let's just first do that first layer of shame.
Like what a failure it must feel like to be told and how much of a hopeless place that hearing treatment resistant depression might bring you to.
Yeah.
Like, cause it is like, okay, what is the point? If I'm so resistant, if I'm not gonna get better,
Mm-hmm.
like how awful of a feeling is that?
Mm-hmm.
No one wants to hear that. How it like you're right. Like if we're being told this and this may solidify someone's mindset, how are they going to try a new tool, try a new type of treatment, work on some limiting beliefs, or try something else to get better if we're told that, like, well, I don't know, you're resistant?
Yeah. Yeah. You're too broken and you are somehow choosing to stay broken. I feel like the term resistance often to me suggests volition, like they have a choice and they could be trying harder. And sometimes I don't want to also just like pretend like that's not true. Sometimes there is a need to have really hard conversations with a client. I've had to have people have these conversations with me as an individual in my own therapeutic journey of like, if you're not willing to be the hardest working person in the room, you're not going to see change. So there is that part of it that sometimes people are resistant or they are actively resisting the work. And that's not often what is suggested here with this term. It's the idea that you are just too broken to be fixed. And then if you're labeled as treatment resistant, which sucks because even for some types of therapy, I mean, I don't know how much this is the case for like CAP or for other like PAP, but other forms of therapy like this in the past, it's like you have to fail so many other forms of therapy before you quote unquote pass into this thing, which like how terrible does that sound to someone? Like I need you to stay maybe suicidal, maybe just like so depressed, maybe engaging in self-harm practices or addiction. I need you to stay there long enough that now we're willing to try this thing on you. Like that feels really tricky to me. But I also want to introduce the other idea because I'm curious what comes up. How do we then, because this isn't something that it's like not everybody needs ketamine assisted therapy or other psychedelic assisted therapy, maybe it could benefit everyone. I think there's a lot of people that believe that that could be the case. I don't know enough. I'm at a 7. I'd have to learn more, but there's a chance. How do you then know what the threshold is to know, particularly as we're still learning and doing research and we're getting people trained and doing this in an appropriate way? How do we know the threshold for when someone should do it? And how do we talk about their mental health struggles in a way that isn't so shame inducing?
Hmm. I mean, I think there's so much that goes into it, but I think if someone is wanting to do the work and wanting a change in their life, I mean, for me, that's almost enough to have at least like the consult with them, to have
Mm-hmm.
at least like explore these possibilities, explore what has and hasn't worked for them in the past.
Mm-hmm.
Generally, my clients have already been in talk therapy or done different types of therapy, but just not gone the medicine route. A lot of times they're already on antidepressants or even antipsychotics, anti-anxiety medication. A lot of times there is that, and usually they're at an okay baseline, like they're living life, I guess.
Mm-hmm.
But there's a huge missing piece for them, and it's not like being able to enjoy life. And yes, like antidepressants and all the other stuff is supposed to take away like the hardest parts. It's supposed
Mm-hmm.
to like take the edge off of that stuff. But like if we're not getting to enjoy life, like what the fuck is the point?
Yeah. Yeah.
Like what are we here for if we can't
Yes.
make some meaning and have, I mean, I don't think you need to have purpose to enjoy life, but like find purpose if that's what you're down
Yeah.
for. So in terms of screening for eligibility, like I also ask a lot about like what is their motivation
Mm.
and how motivated are you to make these changes, because it doesn't only happen in the preparation before or even the dosing session. We get to work right after the psychedelic therapy session because that's when the brain is in that state of neuroplasticity so that we can make
Mm.
those changes to create new patterns for them.
Mm-hmm.
That's where the magic happens.
Yeah. Well, and I think a lot about one of the things that I have felt, there's obviously a very complex relationship with my mom, but one of the things that I struggled with for many years is she was diagnosed in prison as having bipolar disorder, with her manic episodes all being, at the time she experienced them, there was always crack cocaine or some other drug involved. So at the time she was diagnosed, I was a teenager. I didn't know enough to know about this. I'm not the therapist or the psychiatrist in the room, but she was given this diagnosis and then of bipolar disorder and then these other very specific diagnoses. And my mom is somebody who has collected diagnoses in her life. And I think a lot of her identity comes through these different diagnoses that she's had. But they put her on medication. And then what I would struggle with was this idea of she's just sort of existing. Like my anger was often, I feel like they medicated her so she stops being a disruption to society. But she was on so much Seroquel at one point, she passed out on a heating pad that burned her face with 3rd-degree burns, and she was in the hospital for weeks because she was on such a high dose of this sedative. And so I've always struggled with this. And I think about somebody that's been put on medication and has engaged in talk therapy for, I mean, at least 20 years at this point. And I am not her. This is my work I'm working on because I'm not always the best at this, where I have to recognize that what she chooses to do in her life is her right. And what I want for her to do doesn't always match that. And that fucking sucks. And I don't like it. And I still want to just be like, be better, do more, try harder. But I think the conditioning around, she has just, again, this is my experience. She might think something different, but like she has just sort of existed for the last 20 years. But at least she's not doing cocaine. At least she's not manic. Like that feels like what it is. And a lot of our recent work and boundaries I've had to set is around, we've never processed any of the trauma that has happened in our lives collectively. And you have never moved through any of the pain and trauma of your life before me, which my mom would meet full-blown criteria for CPTSD if that ever became an actual diagnosis. And so I also in the same breath have such empathy for her of like, the system feels like it's not working for you. And now I feel like you've just sort of given into the system. So I don't exactly know what my goal is by sharing her as an example, other than to say that I think it happens more frequently than we realize for people, that they get sort of put on a conveyor belt and they just sort of exist, and at least they're not X. And then we're just sort of avoidant goal setting for them. Like at least they're not doing these things. They don't want to kill themselves. They're not self-harming. They're no longer addicted, but we're not creating the opportunity for approach goals. What is a life that you would be, even if excitement's not the right word, but for lack of a better one right now, like that you would be excited to lead? What would that look like? Is that this? And if it is, great. But what would it look like to even allow the possibility that it isn't? And I feel like some of the work that you're doing and the movement that can happen. I mean, we were talking offline before we hit record. Like, I still have such a deeply rooted trauma response that anytime I am woken up, and my husband works in emergency medicine, so I'm woken up in the middle of the night a fuck ton, I have a full trauma reaction. Like, I am, no matter what, no matter how he enters, no matter what he does, it could be loud, it could be quiet, I will have it. There's something that hasn't moved that I haven't been able to talk through because I feel fine. Talk therapeutically. I don't think that's the way to describe it, but it's like I'm not thriving there. And I'm seeing maybe that's what's happening is I'm starting to put these pieces together, whether it's someone with a story like my mom, which unfortunately is a lot of people, decades of medication and subpar therapeutic interactions to just learn how to exist. Or it's someone like me where I go, but it's not that bad. And so I should be fine. And then I have shame about the idea that I can't figure my shit out and figure out why I'm still having trauma responses when I sleep. And it feels like both of those cases are the types of conversations that then something like ketamine assisted therapy might come into play to be a support for.
Oh, yeah. So there's different uses of ketamine, and one way to administer it is intranasal, and that's
Mm-hmm.
called Spravato. And a lot of times it's covered by insurance, but a lot of times the insurance requires you to have tried at least 2 different SSRIs or antidepressants and have that be like considered a failure for you in treating whatever you're trying to get
Dang.
through until they cover Spravato. So we are conditioned to jump through all the hoops, get
Mm-hmm.
worse before we get better,
Mm-hmm.
live a life of just like blah rather than living a life that like we would enjoy living.
Mm. Yeah. And the conditioning to then put us in a position to accept that. And then when it becomes your norm, you individually might not even be aware anymore that that isn't thriving or that the ceiling has been lowered by decades of conditioning. And that is what scares me. And I think that's the thing that I still I have to figure out how to help in a way that doesn't inadvertently then bully the individual who's been affected by the system. Obviously, I'm much more emotive with my mom than I am someone else. It's a much more complex relationship. But I think then it's like frustration at the end user when the problem wasn't necessarily them. The problem was a system that has also been conditioned to just avoid chaos and like treat to a certain point and then not re-ask the questions. Not, like when I brought up her diagnosis years ago, I'm like, Mom, I actually don't know I can't diagnose you. I'm your daughter, but I question whether or not you have bipolar disorder. I question if it's not something else that presents in certain ways that has a lot more to do with trauma and these manic episodes being drug induced or substance induced and your brain sort of being out of whack. And that would open up a whole different conversation for maybe her pain and the way that she has her story figured out. And so it's tricky because I also think for many people, their identity has become about those things. Like, I am this treatment resistant client that has had depression since I was whatever age, or I'm this person, I'm this chronically whatever, unhappy or negatively charged individual. It almost feels like it would be easier to stay there than to allow the possibility it could be something better, because the other fear, which they've likely experienced before they got to this point, is it could be worse. And that right there feels like that's where the shame comes in of, but if my belief and my core belief is still rooted over on this side, I don't understand why you're trying to talk to me about swinging over here when I can't even allow the possibility that that's an outcome for me, because I am broken. I am the problem, and it will get worse if I don't just accept this mediocre feeling.
That's learned helplessness, baby. If we think that there's like no opportunity or no future for things to get better, we're going to stay over here in this shitty place
Mhm.
where we know it's safe enough of like, okay, it's not worse than where I'm at right now. So I guess I'll just stay here because if I try something else, I don't think it'll get better.
Yeah. And that, I think, is where the shame comes in then for many people, and particularly this notion of then, I should be able to be okay here. And this is where I'm going to be. And I think about even the other layer of shame and how we can empower people who might be like, gosh, I'm curious about whether it is ketamine assisted therapy. Maybe they're like, oh, Kyira, you said brain spotting. What in the world does that mean? Like, whatever those things are, there's also then this, well, what are other people going to think? And what's the expectation? And what if nothing changes? And so there's all these like complex and complicated, intertwined, entangled, I don't know what word I'm looking for, components that again, I think reinforce that. And so for people that are listening to this and they're like, okay, I remember one of the things that you said to me in our first episode we recorded was like, how did you get in my head? And now I'm thinking about listeners thinking, how did we get in their heads, to describe maybe that feeling of learned helplessness that they might have. But there's still the shame around, what are other people going to think? Are people going to judge me? I don't want to have to feel like I'm broken to try to get better, but also that fear around and that learned helplessness component of like, what if I try and it doesn't work? What would you say to that listener, or to the person who is going to support that listener who's in that space?
Ooh. I would be honest with them because I don't think using psychedelics is going to be a magic pill to just like change their life around. And I don't think anything would be anyways. Like there's no magical button to like make them feel better.
Yeah.
And there are so many variables here that go into medicine. Like even in a place of using like specifically ketamine, maybe the route did not bode well for the person. Maybe ketamine itself is not the right medicine for them, but there might be an alternative.
Mm-hmm.
And so it's hard to say this because it doesn't sound like it's giving hope, but I would want to be honest with them and let them know yeah, there is a possibility that we go through a whole round of treatment and there still may be a lot of pieces left to pick up and still so much to explore, and maybe you didn't get the outcome that you were looking for. And this is why we have the conversation beforehand. Like, what would it be like if you were to try this medicine and nothing changed and
Mm-hmm.
nothing happened? And we check to see if people are looking at this type of treatment as a one-stop shop to fix all their
Mm-hmm.
problems, because it's not.
Yeah.
It's not going to do that for anybody. Just as if, I mean, sometimes talk therapy can do that for people, but I mean, there's so many aspects outside of talk therapy that we need to
Mm-hmm.
work on, right? Our physical health, our emotional health outside of session, mental, social, like there's so many aspects to contribute to good treatment outcomes.
Mm-hmm.
And what I would say for like the shame that comes up of, oh my gosh, like, is my brain this messed up that I need to try this medicine?
Mm-hmm.
I would say your brain is not messed up. I mean, I would reassure them and normalize this and let them know that this is just an opportunity to set aside some space and time and go inward into yourself
Mm-hmm.
and have your own journey to see what's there underneath the surface, to see what might not be so far in the front of your consciousness. And it could really help pick up a lot of the pieces that feel like have been missing over the years of treatment or over how long you've been struggling with a particular issue.
Mm-hmm.
What I really love about the medicine is, even if it feels like, I just had this happen in a recent session, even if it feels like you're like getting nothing out of the session, you're still going to be in this place of neuroplasticity. Your
Mm.
brain is still going to do a lot of work even outside of the actual medicine and dosing. So there could still be hope, even if it feels like, I got nothing out of that session during a dosing
Mm.
time. Your brain's still going to be working really, really hard. And with that caveat that, yeah, psychedelics aren't going to be for everybody. I don't know what the statistics are, but sometimes you're not a good fit of actually receiving treatment and movement into the direction you need to go, just because that's not the right fit for your particular brain. And that's okay. There's alternatives out there.
I think what you're saying that ultimately feels the most shame resilient. There's two things that came up. So one is this idea that I need to be okay. I need to fix it. I need to solve it. I need it to be done. That drive for completeness, which ends up resulting in that, like what you're describing, someone maybe coming in being like, this is going to fix it all for me. And that sort of false hope, or what ultimately leads a lot of people, I think, to suppress because they should be fine and they should have been able to fix it and it should be done by now. I think that drive for completeness is a cultural norm that's a pretty fucked up sort of perpetuation that the doing and the performing is more important than the being, and that things are solvable, fixable, as opposed to suffering, joy, fulfillment are all experiences that ebb and flow, and that really healing is a contextual and long-term experience. And so one thing that I think as you were talking, I thought about was really starting to empower someone to think about their pain not as a problem to be fixed, but as an experience to be explored within which they can continue to redefine their relationship with it. And I think that, ultimately, the trauma I went through is never going to go away. It's my relationship with it that sometimes still really fucks me in relationships because I haven't reworked it. And I do end up using it as leverage, and I shame other people or I stay in a state of shame. But the places where I've done some of that work, my reframe has healed how I approach other things. So it's not that the pain's gone away. Again, I've just reframed it. The second thing then is this idea of, you described treatment efficacy in such a neutral way. And I think that people personalize it so much. And so it's thinking about this idea that we are nowhere near understanding the entire brain and body. And what we're developing as quote unquote treatment is based off the information that we have to this point. So the idea that we have found the things that will help every single brain and body is screwed up. That's not real. It's not true. It's a lie. And so the idea that something doesn't work for you doesn't mean you're broken. It means that we're still exploring what healing can look like, and everybody is different. And so I'm kind of sifting through and maybe telling myself things that I still need to hear of like what those takeaways can be from a place of empowerment for each of us. So whether or not you do try some form of psychedelic assisted therapy, or it's recommended to you, or some other form of therapy, even for somebody who's like, fuck, the idea of talk therapy even feels overwhelming and I don't know what to do. It's allowing the possibility, again, of reframing and exploring and establishing a new relationship with our pain, our distress, and our discomfort to allow the possibility that it can continue to move rather than decide it's all or nothing, fixed or stagnant, and this is where I'm meant to be. Okay. I know I'm seeing you nod, and I know we're also aware, like, we have to, if I ask you another question, we're down a rabbit hole. We're going to be here all day. So let me do this, because there are people that are going to be like, I do want to know more, or maybe I want to explore this, or I have questions, or I'm going to go back and listen to Paige's first episode with you. And she just feels like somebody that I want to know more about. So one, if you could give people an invitation for just one takeaway today, one idea, one concept, something, what would that be? And then two, for everybody that's like, okay, now I just need to go get Paige in my life, where do they go to find you?
Hmm. I think the takeaway in going into this space in terms of psychedelics is something we talk about a lot to hold space for, is instead of having goals and like having a particular outcome because we feel pretty bad when we don't get that goal met or achieved and we don't have that outcome happen, is we're going to round it back to intention.
Mm.
How do you want to live your life, essentially? I work from acceptance and commitment therapy mindset. So we talk a lot about values. Who is the person you want to be? What are you going to be doing differently in your life to be able to like live that kind of life? So we use a lot of that in CAP therapy. What is it that you would like to be different, and how would you know, and what would you be reacting differently to these maybe tough situations you've experienced? So rather than saying, oh, I just wouldn't be depressed anymore. Okay, tell me, design your life and
Mm.
see if you can build some intention around how you want to go through your day, listener. Like, what is it that you would like to be doing differently? Doesn't need to be like this big, high achieving mountain of a goal that like seems impossible to climb. But what is one small step towards that? If you do want to hear more from me, you can come find me on my website, pagebond.com. Kyira, I'm sure we'll have that in the show notes. And you can also hear me on my podcast, Stubborn Love, which Kyira has been a fantastic guest on, speaking about shame in partnerships. Ugh, I refer it to my clients all the time, so I love it. And you can come listen to me and hang out with me there, or hop on my website or my email list and we can chat.
I love it. And listeners, if you're just like, I need another podcast, I know most of us are like, oh, I have a lot. And I'm telling you, Paige's podcast is just so amazing. And so I just bookmark it, just do a little follow, just so it's there for when you're ready. Even if you're, in the middle of your true crime podcast, whatever, right now, I get it, but just like put it there, because there's such a raw openness that she creates in these conversations with her guests that allow us to explore so many different topics and facets in a way that feels non-judgmental. And that is, I think, a gift. that Paige as a person brings, and in particular that her podcast really gives to the world. And so I, of course, will make sure that all of those links are down in the show notes. I'll also make sure it's the first episode of the podcast, but you can go back or click the link in the show notes to hear her first episode that we did talking about ethical non-monogamy and just really exploring a really complex topic there as well and seeing where we went with that. And so Paige, this has been amazing. Listeners, take her invitation, just asking those questions, that curiosity, really thinking about intention versus goals and doing. And of course, check out the show notes, connect with Paige, get any of the resources that I have that can support you, and we will see you back here next Sunday.